इट्स म्हाका एक मस्त खुशें जाता आसा आमगेले जर्मनीचे आमचेगेल समाज बांधव लोकल सांगतीक म्हगेले एक्सपिरियन्स एंड म्हगेले नॉलेज अबाउट डेंटल हेल्थ शेअर करचाका हांव बिफोर स्टार्टींग म्हगेल बगे एक सानो इंट्रोडक्शन दिवका म्हणून दिसता म्हाका म्हगेलें नांव लक्ष्मीनारायण म्हणून हांव शिरसीच्यान उत्तर कन्नडा डिस्ट्रिक्ट. Then I studied in BDS in Davangere and Magiri MDS community dentistry in Bangalore antu Shikla. Tadnantar worked in Mangalore for 8 years as a assistant professor, then associate professor in community dentistry. And then I moved to Germany. Thai European Master of Public Health kele. Magiri, I started working in a dental practice in Germany, and because of that, Magiri, how German into dental licensing apply korno, ata exam prepare karta sa. And next year, I'll be starting to work in that clinic in Hamburg as assistant dentist also. That is about me. Right now, I'm in India. Because of my health reasons, I had to move back to India, and right now I'm working in here in India. But soon I'll be going back to Germany. ते मग कसाले सांगतास म्हळ्यार there has been changes जाता उरता dentistry into science antu. So there because of some developments, rules changes of rules जावन थोडे इतले changes जाल्ले उरताले मागीर information whatever हांव दिता ते आउटडेट जावन उरचे चान्सेस बी आसा. So that is why I told that म्हळ्यार एक वर्षा मागशीचे information whichever I am telling. So with that हांव slowly start करता. I'm going to share my screen now. तुमकां पुरो जनाक गोत आसा what is the आमगेले ओरल हेल्थाचे इम्पॉर्टन्स कसो न्ही म्हणून आमकां दांत अशे अथवा आमगेले तोंडाचे आरोग्य मेंटेन करचे खावच्याक हेल्प जावचे मात्र न्हय ते आमकां उलोवचे वरके हेल्प करता म्हळ्यार आमगेले दांत आमगेले लिप्साक सपोर्ट करता ताजे निमित्त आमकां उलोवचे जाता आमकां तुमी ओल्ड जायना पण मांतार लोकांक डेंचर्स आनी वेअरिंग अशी लोकांक तुमी पळोवचे पुरो तांगेले उलोवणे म्हळ्यार स्पीच इज नॉट व्हेरी नॉर्मल न्हू अँड ऑल्सो आमगेले दांत आशिल्ले निमित्त आमी सोसायटी सांगता सोशलायज करचे जाता बिकॉज ऑफ आमगेले दांत आमकां एक कॉन्फिडन्स आसा ते दांत ना जाल्यार आमगेले तोंड डिफरंट टायप दिसून आमकां आमकां भायर एका सोसायटीन कम्युनिकेट करचे कश्ट जाता अँड ऑल्सो तुमी पळोवचे पुरो कितले लोक ड्युरिंग द कोविड ते मास्क घालून भोंवता आशिल्ले न्हू त्या टायमारचे टेक्नीक आज बी यूज करता वेन दे रिमूव द टूथ फ्रंट टूथ काडिल तेन्ना नाजाल्यार एक ट्रीटमेंट जाता आसतना ते मास्क कवर करून घेवन भोंवताचे दॅट इज बिकॉज एवरीबडी इज ashamed to have a bad teeth. So that means that the teeth are very important amgele social health खातीर. And not only that amgele oral health is also linked to our general health. But ताची importance हांव मागीर when I'm talking about periodontal disease ಬಗ್ಗೆ म्हळ्यार gum disease ಬಗ್ಗೆ उलयतना ताजे ಬಗ್ಗೆ चड उलयता. बट इतलो उडगास दवरूंक घेया की आमगेले ओरल हेल्थ सम ना जाल्यार आमगेले खावचे म्हळ्यार न्यूट्रिशनल प्रॉब्लेम्स येवचे इतले न्हय ऑल्सो अदर डिसीजेस बी येवचे चान्सेस चड जाता वता. कॉमन ओरल प्रॉब्लेम्स तुमकां कुटुंबाक गोत आशिल्ले सांगता दॅट इज दांत कीड खावची म्हणटाची दॅट इज केरीस म्हणटाची आनी जर्मनीन तू खारीस म्हणटाची. पेरियोडॉन्टल डिसीज म्हळ्यार गम डिसीज निज्जाचे इन्फेक्शन ताका जर्मनीन तू पारोडॉन्टाल म्हणटाचे एरक्रांकूंग म्हणटाचे. आनी थर्ड इम्पॉर्टंट म्हळ्यार कॉमनेस्ट दिसचे आमगेले लोकांक इज माल ओक्लुजन म्हळ्यार आड उड उरचे दांत हांगा की फॉर ऑर्थोपेडिशा प्रॉब्लेम म्हणटाची नाजाल्यार जान फेल स्टेलुंगन म्हणटाची. सो तुमकां कळचे पुरो आतां टुथाचे जर्मन वर्ड इज छान. सो दिस इज नॉर्मल छान. हातूंत भितरी चड डिटेलांत वतना हांव बट मेनली आमकां तोंडांत आमगेले दांताचे पार्ट दिसता पळय ताका आमी क्राउन म्हणचे आनी ते बोना भितर ताचे रूट्स उरताचे एक एक दांताक एक रूट उरता आणि एक एक दांताक 2 ना 3 रूट्स उरचे चान्सेस आसा. एग्जांपल म्हळ्यार आमगेले अपर मोल जॉ आशिल्ले मोलार्साक 3 रूट्स उरताचे आणि तोगूच मोलार्साक 2 रूट्स उरताचे. एक एक पंत ते अबनॉर्मल केसेस सांतू 2 अशे 3 बी अशे चान्स उरता, एक एक पंत 3 आशिल्लो 4 अशे बी चान्स उरता, बट दॅट इज व्हेरी रेअर. मागीर इम्पॉर्टंट डेंटल डिसीज विच इज व्हेरी व्हेरी कॉमन म्हळ्यार केरीस ऑर दांता कीड खावचे म्हणटात न्हू ते. सो दांता कीड खावचे भायरचे लेयर स्टार्ट जाता आणि भितर मूव जाता. हे फर्स्ट पिक्चरांत पळयलें म्हणकी हांगा केरीस हे काळे दिसता ब्राऊन कलर. दिस इज इनिशियल स्टेज. हांतू कसं म्हळ्यार आउटर मोस्ट लेयर हांतू इफेक्ट जाला. हे पिक्चर रॉंग आसा. अशी भितर स्टार्ट जायना केन्ना. इट विल बी ऑलवेज फ्रॉम द स्टार्टिंग आउटर सरफेस. सो इमॅजिन इट इज स्टार्टिंग फ्रॉम हियर आउटर सरफेस. हे आउटर मोस्ट सरफेसाचे ऑफ द टूथ आशिल्ले तेन्ना हाका एनॅमल केरीस म्हणटाचे, बिकॉज द पार्ट ऑफ द टूथ इज एनॅमल. भितर डेंटीन आसता आणि ताजे भितर पल्प म्हूण आसता. दॅट इज द तांबडे दिसचे आसता पळय, ह्याक पल्प ऑफ द टूथ म्हणटाचे. हे पल्पान तू आमगेले दांता सप्लाय करचे नर्व्स, रक्तनाळ पुरा उरता. हे हे आमगेले मोस्ट सेन्सिटिव्ह पार्ट उरता दांताचे. आणि ताजे भायर अशे डेंटीन, हे डेंटीन येल्लो कलर दिसता पळय, हे मिडल लेयर ऑफ द टूथ. हांतू भितर ब्लड वेसल्स आनी आसना, बट नर्व्स आसताचे. सो केन्ना केरीस म्हळ्यार दांत कीड खाल्ल्या फर्स्ट लेयर स्टार्ट जाले तेन्ना आमकां पेन आसना ऑर सेन्सिटिव्हिटी वरके आसना मोस्ट ऑफ द केसेस सांगतो. बट ते एज ते डीप वता 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 डेंटीना टच जाले तेन्ना सेन्सिटिव्हिटी स्टार्ट जाता. दॅट कुड बी द फर्स्ट सिम्पटम ऑफ युअर डेंटल केरीस. बट तेन्ना वरके नेग्लेक्ट केले रे, तेन्ना त्या भितरचे लेयराक वचून टच जाता, ताका पल्प म्हणटाचे. एक पण ताका टच जाले रे, यू कॅन सी दॅट रेड आशिल्ले डेड जायना पंत ब्लॅक जाला. सो दॅट मिन्स एक पंत केरीस ते म्हळ्यार तांतू भितर आशिल्ले बॅक्टेरियास केन्ना नर्व्साक भितर वताचे, ते इन्फेक्शन जावन परिवर्तन जाता आणि तदनंतर हे दांत फिल करचे जायना. हे इन्फेक्शन आमी कंप्लिटली भितरच्यान काडका पडता. एज आय टोल्ड यू, एक एक दांताक 2-2, 3-3 रूट उरताचे. सो तितले कितले चड रूट उरता तितले कष्ट जाता वता ते क्लीन करचे. कशी जावचे केरीस म्हण तुमकां पुरो जनाक गोतुरचे पुरो मोस्टली जावचे आमगेले बॅड ओरल ಹೈಜೀನಾच्या निमित्त. दॅट आमी सम नियमितವಾಗಿ 2-2 पंत नाले एव्हरी डे सम ब्रश करचे नाजाल्यार केल्यार वरके ते सम करचे ना, पुरा सरफेस पावनाशी करचे. आणि करेक्ट दांता मद्दी 2 दांता मद्दी क्लीन करनाशी पळोवंक घेवचे. इन दॅट केस थंय केरीस म्हळ्यार 2 दांता मद्दी केरीस जावचे चान्स जाता. आणि केन्ना आमगेले केरीस जावचेक एक रिजन म्हूण उरना, ताका 3 रिजन उरता. 3 रिजन म्हळ्यार एक पुअर ओरल हायजीन, आणि ससेप्टेबल टूथ, आणि ताका एक सबस्ट्रेट दॅट इज स्वीट ऑर द फूड. सो हे तिन्ही जॉईन जाले तेन्ना मात्र केरीस जावचे चान्स आसा. जस्ट बॅड ओरल हायजीन जाल्यार केरीस जायना, जस्ट शुगर खाल्यार केरीस जायना, जस्ट बॅड ससेप्टेबल टूथ असल्यार बी जायना. सो हे तिन्ही कॉम्बिनेशन जाले तेन्ना मात्र केरीस स्टार्ट जाता. सो हे मोस्ट ऑफ द रिजन्स हांगा दिल्ले केरीसाचे, दे आर जस्ट निमित्त मात्र ते, बट इट हॅज टू बी कंबायन्ड विथ अदर फॅक्टर्स केरीस स्टार्ट जावचेक. सो एज इट इज हे पिक्चरान दाखयलें म्हणकी टूथ ससेप्टेबल आसा म्हळ्यार वीक आसा ताजे स्ट्रक्चर. तू मस्त स्वीट खाता नाजाल्यार तुगेल्या तोंडान तू केरीस जावच तसले बॅक्टेरिया आसा. हे एक एक आसतना और 2 आसतना वरके केरीस जावचे साध्य ना. हे तिन्ही कॉम्बिनेशन असल्यार मात्र केरीस जाता. So that is why I cannot answer clearly ki whether the dental caries is caused by genetics or not. कितकी लोक म्हणटाचे genetics च्यान caries जातवा दांता कीड खातवा म्हणून. The answer is yain, because dental caries is not purely genetic, because it's a bacterial disease. Bacteria च्यान जावचे, but ते bacteria ते दांतार बस का, ते दांताचे ओरल कॅव्हिटीन तशील कंडिशन्स तसं लाक कंड्युसिव्ह उर का, तेन्ना मात्र कॅव्हिटी स्टार्ट जाता. So that is why it is not easy to answer when somebody asks you की dental caries genetically जातवा म्हणून. बिकॉज आता आमगेले जेनेटिकली आमी दांताचे स्ट्रक्चर जेनेटिकली इनहेरिट जाल्लो आसता. सलायवरी ग्लँड्स म्हळ्यार आमगेले उश्टी प्रोड्यूस करचे ग्लँड्साचे इनहेरिट जावचे जेनेटिकली असता. सो इफ यू हॅव अ व्हेरी बॅड ऑर जेनेटिकली poorly developed salivary glands as malare dry mouth jata. So dry mouth is one of the risk factor for caries. So caries and the types asache mainly दोन type of caries पळोवेत तुम्ही. एक स्मूथ सरफेस caries आमगेल दांताचे सरफेस अस पुरा एक नमन असना हंग पळयले म्हणकी हंगा तो गुज पिक्चर अंतो हे स्मूथ सरफेस अस आणि दोन दांतामध्ये असे सरफेसेस वरके स्मूथ उरता. दांताच वयरच पोर्शन खंय आमी चापताच पळय ते स्मूथ असना कसं जालें म्हळ्यार थंय कस्प्स म्हणून उरता, माउंट्स ऑफ टूथ डेव्हलप जाल्ले उरता सो दॅट वी कॅन च्यू फूड. सो ते माउंट्साच्या मदीं एक रिव्हरशी उरता पळय ते दॅट इज कॉल्ड एज फिशर. हांगा तो पिक्चरान दिसचे पुरो हे फिशर आणि हे स्मूथ सरफेस. सो केरीस ससेप्टेबल मोस्ट चेडूवांतू ऑर यंग एडल्ट्स अंतू हे सरफेसार आणि older adults anto and other people also, even younger adults anto be tooth smooth surfaces where you cannot clean in between the tooth very efficiently compared to this surface. This surface pura loka brush kartat samaje, but anga iltana the brushing efficient asana, so there more chances of dental caries jata with aging. So that is why we have to prevent it. But prevention is not very easy. So at least prevention jalna jalare we have to understand early symptoms. Early symptoms कळल्यार आमकां effective treatment करू जाता. So how do you know whether you have got a decay? One is food starts getting in between the teeth. म्हळ्यार most of the times if the caries is between your two teeth, म्हळ्यार दोन दांतांमध्ये कीड खाल्ला आशिल्लो असल्यार तेन्ना food starts getting stuck in between the teeth. Sometimes म्हळ्यार चापची सरफेस जर caries जाल्यार बी थंय वरके फूड वचून बसता. Then bad breath. It is not only because तुमगेल फूड वचून ते accumulate जावन ते rot जावन स्मेल येता नाही. Even caries ते petrifaction factor जाता असता the dental tissues and that also can lead to bad smell. Then of course toothache, which you all know, toothache and tooth sensitivity ailtana it might be already in the later stage of the disease. So this is हे जाऊच पहिले आयडेंटिफाय करचे आमगेले गोल आसका केन्ना ते कश करका म्हणून हांव सांगता मागीर. How to prevent? As I told you, it is not always easy to prevent dental caries, but it is possible. 100% you cannot prevent, but to some extent करचे जाता. कशी म्हळ्यार एवरी डे समा 2 टाइम ब्रश करचे, प्रॉपर फ्लोराइड यूज करचे. फ्लोराइड म्हळ्यार एक केमिकल आमगेल ब्रश सॉरी आमगेल पेस्ट अंत उरता and the fluoride ashil paste use करच्या जेन्ना ते bacteria will die. And also fluoride कसा करता म्हळ्यार आमगेले कॅल्शियम फॉस्फेट असता टूथ अंतू त्यात सांग ती कंबाईन करून फ्लोर अपटाइट म्हणून एक क्रिस्टल्स प्रोड्यूस करता. ते मोर रेजिस्टंट टू ऍसिड. Acid is the cause of the cavities. So acid cheka more resistance ashila jana fluoride ashile paste use केल्यारी आम्ही caries to a considerable extent prevent koret. Then also in certain cases high caries risk ashil patients aka dentist also helps in the fluoride application. म्हळ्यार professionally fluoride application करताचे. मागीर scaling of the teeth म्हळ्यार रेग्युलर प्रोफेशनल क्लिनिंग गेले रे डेंटिस्टालेगी. Then they will also help in the prevention of plaque accumulation. Plaque म्हळ्यार तुमको पुरो गोत आसचे पुरो. Plaque is one of the bacterial layer that forms on the surface of the tooth. If you don't brush for 12 hours, ताजे वयरी टूथाचे आउटर सरफेस वयरी plaque म्हणून एक लेयर फॉर्म जाता. And that is the rich in bacteria, and that bacteria is the cause for all the oral diseases. And that is why professional cleaning kella jana kasat male the surface becomes smoother, so the plaque accumulation slow jata आणि plaque retention areas म्हणून उरताचे like एक high rough surface of the filling उरचा पुरा तुमगेल पुडले केल्ले ना जाल्यार over the period of time brushing करून काहीतरी rough जाल उरचा पुरा, and those are the retention places for the plaque. So the professional cleaning केल्यारी ते रिटेन्शन एरियाज आणि त्यांनी काढताची आणि तदनंतर ते प्लाक एक्युमुलेशन स्लो जातात. आणि लास्ट बट नॉट द लिस्ट is pit and fisher sealants, but this is not possible in adults. It is only for the younger adults, like at least maximum 2 to 3 years after the tooth eruption. आता फर्स्ट मोलर आमका 6 years एजाक झाल्या म्हणा रे, ते दांताक केरीज जायनाशी प्रिव्हेंट करचे का विदिन द एज ऑफ 8 त्या दांताक सिलेंट अप्लाय करका पडता. त्या सिलेंट कसा नाही म्हणू आम्ही पळोया मागीर. So as I told you, tumge dentist will help you in the fluoride application. There are multiple methods. One is tumi oral prophylaxis or professional cleaning of the tooth ageltana. They might apply fluoride paste that is high concentration urtutantu fluoride ache ani te tumge tondantu tani for 1 minute or so they will keep it so that the absorption jata. Ani tani other fluoride supplements might be prescribed to you, like high fluoride containing toothpaste like MX or fluoride mouthwashes or pit and fissure sealants. Pit and fissure sealants हांव सांगिल म्हणकी तुमगेले दांतांतू डीप ग्रूव्स उरताची कस्पसा मध्ये अशी रिव्हरशी फ्लो जातात. सो दिस इज नॉट इजी टू क्लीन. ताजे निमित्त थंय केरी स्टार्ट जावचे. बट दिस इज ओनली इन यंगर एडल्ट्स and that is why hang younger adults antu sealants apply kelare this area will become sealed and tadnantara thai caries jawche chances kami jata. So that is why in Germany they specifically even insurance also pays for this. All the young adults below the age of 18 they recommend to go for this pit and fissure sealant application. हे कसं ना, it is nothing but a small सिरिंज नाजाल्यार ब्रशाचे ना अप्लाय करचे सिमेंट लायक मटेरियल आणि लाईट क्यूर करतात. सो व्हॉट इफ केरीज प्रिव्हेंट करचे जाय न्ही, देन ओनली ऑप्शन इज ट्रीटमेंट. ट्रीटमेंट अर्ली स्टेज अंतू डिफरंट and later stages अंतू डिफरंट. एज आय टोल्ड यू बिफोर, आम्ही इनॅमल नाजाल्यार डेंटिन अंतू केरीज असताना ताका ट्रीटमेंट केले रे, देन यू कॅन डू द फिलिंग्स. ऑफकोर्स आता जर्मनीन सिल्वर अमाल्गम इज बॅन्ड. This is one of the big change last 1 year anto. Last हांव जर्मनी सोडच पुढे सिल्वर अमाल्गम आनीक फिलिंग करता आशिल्ले, but I think last another 8 to 12 months back I think they have banned it completely, and now I think even the composite fillings are being paid by the health insurances. Then एक पण तर डेंट इन क्रॉस जायना पण इन्फेक्शन जाता, सो पेन जावचे चान्सेस असता. So that time the only possibility is root canal treatment. So root canal treatment केल्यारी आम्ही दांत सेव करायचं. I asked this question in the WhatsApp and almost many people answered correctly that root canal treatment is the most cost effective method for saving the tooth when the tooth pain already starts नंतर. Why? Because एक दांत तुम्ही काढल्यारी तदनंतर ते प्लेस नाव आम्ही वापस फिल करचे का म्हळ्यार विथ अ न्यू टूथ using a denture najalari bridge najale implant will be much more expensive than the root canal treatment, because root canal treatment at the outset tumka costly dishe puro, but once taje long term hai padale re, and even the studies have shown that at least 80 to 90% success rate of root canal treatment aswilajana, we can say that root canal treatment is the most cost effective method. But as I said, nothing is perfect. 10 to 20% cases are त्यावर के failure जाता जायना म्हणणं. मागीर worst case, the tooth already weak jala, completely broken down because of the caries, or it has spread to the roots also, or to the bone surrounding the tooth to a considerable extent, so that the root canal success remains very low. In that case, it is better to go for the extraction. And even tumgele health insurance advanced cases antu root canal pay karna, because they also know that success rate is very low, and that is why at that time your dentist will also tell you to go for the tooth removal. Second important disease with the after dental caries is periodontal disease. In fact, periodontal disease kasa सांगा म्हळ्यार major cause for tooth loss more than dental caries actually. dental care is a widely spread disease asler worke, but major tooth loss in majority of the people is because of periodontal disease. Periodontal disease malar kasan malari amgele nijjache infection, निज्जांतू चड डेपॉजिट्स हांगा पळयलें म्हणकी प्लाक म्हणल्या फर्स्ट. सो प्लाक फर्स्ट एक्युमुलेट जाता, ओवर द पिरियड ऑफ टाइम ते हार्डन जाता वता, तद नंतर कॅल्सिफाय जाता. सो कॅल्सिफाय जायना पर्यंत ताका कॅल्क्युलस म्हणून सांगताचे. अँड द कॅल्क्युलस इज मोर हार्मफुल बिकॉज कॅल्क्युलस विल नॉट लेट यू टू क्लीन द प्लाक प्रॉपरली. सो प्लाकांतू नथिंग बट बॅक्टेरियास असता. सो द टॉक्सिन्स all start accumulating and releasing it in the neighboring tissue, that is gingiva. So anto gingiva antu the toxins vata kasa at malare inflammation jata. Inflammation malare nothing but irritation maneta. So inflammation in due course of time converts into infection. So kasa jata, what happens because of gingivitis? At this time it is the hair infection hanga only superficial tissues ant asta. So that is why it is called as gingivitis. Ek panta hair barrier cross jal nantara it goes in deeper वचून bones आक affect करता. आमगेल टूथाचे surrounding कसा ने म्हळ्यार bones are the structures that hold the tooth in the jaw. So एक पंत हे toxins bone लगी reach जायना पंता it starts dissolving the bone. So हे bone dissolve जाता 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 कसा जात म्हळ्यार हाजे लेवल उणे जाता वता. हे तोग वता असताना ऑब्वियसली रूट एक्सपोज जाता वता. हे एक्सपोज जायना पंता रूट सपोर्ट असना and the tooth becomes loose. And once the tooth becomes loose to a considerable extent, even if you do the treatment for periodontal disease and even if you remove all the toxins there, it cannot be reversed once after certain limit. So that is why periodontal disease in the early stages only तुम्ही treatment करायला रे ते bone growth जाता आणि आमगेल tooth थंय socket आणतो or jaw आणतो गट्टी जाता. So हे gingivitis and periodontitis conversion केन्ना जात म्हणून सांगूचे जायना. In some people it is fast and some people it is very slow, and it depends on your immunity, and immunity depends on many other factors. For example, diabetes. A diabetes ashil patient taka gingivitis to periodontitis will happen within days, and it can lead to infection, then abscess. एक पण तश जायना पण दांत काढका पडता. So this is another important disease from a dentist point of view. And how to identify तुमको periodontitis असकी ना? These are the symptoms. Bleeding जाऊचे, तुम्ही गम्स तुमगेल पडले रे तांबडे दिसता, आणि एक पंत रूट एक्सपोज जाता. तुमगेल दांताचे गम्साचे एक लोकल दांत तुम्ही पडोचे बरो लांब दिगो उरता. Why? Because तुमगेल ते गम्स तोगू गेला. And you can see sometimes black yellow deposits. These are the causative factors actually. But because the root exposed jal nimiti dantache sensitivity chad jata, because the root surface and chad nerve endings astache. And that is why old age, and if you see old age people have more sensitive teeth because the gums to recede down. And then of course bad breath and pus exposure. Pus is in the very very extreme cases. Pus pura case periodontitis pura case antu jaina, only periodontal abscess antu jata. What are the causes? Obvious as a causes, that is very bad hygiene. Other things like hormone changes, like in pregnancy astana periodontitis chances chad. So other things like hormone urtale, certain medication like epilepsy medication घेता असल्यारे, ना जाल्यार cyclosporin तसल immunosuppressants घेता असल्यारे, ना जाल्यार तुमगेल nutrition like very deficient in vitamin C, vitamin A and certain proteins, calciums and vitamin D असल्यारे तुमका periodontitis risk चढ जाता. But हे ಒಟ್ಟು असल्यार risk factors असल्यार वरके periodontitis जायना sure chances असा, provided you have a very good oral hygiene. As I told you, this is also is a multifactorial. Only ajana कॉज जाता म्हणून सांगचे जायना. As I told you, डायबिटीस असेल लोकांक पेरिडोंटायटीस मस्त फास्ट प्रोग्रेस जाता जावचे चान्सेस आसा म्हणले. एट द सेम टाइम आमगेले ओरल हेल्थ जेन्ना जनरल हेल्थ बी एफेक्ट जाता. फॉर एग्जांपल ते पोलांत हांव गेल्ले थोड लोकांन हे डिसीज त्या डिसीज म्हणून गेले, बट कोणी अल्झायमर्स क्लिक केलें ना, कोणी डायबिटीसा क्लिक केलें ना. बट इनफॅक्ट द आन्सर फॉर दॅट क्वेश्चन इज ऑल ऑफ द एबव. ओनली kidney disease anik credible evidence na, but still there are some studies which have shown some link, but they must 100% nahi, but all other disease have been shown to have a link with the oral disease, sorry, oral health. Oral hygiene poor asle re stroke jaw chances urta, diabetes jaw chances urta, dementia jaw chances urta, respiratory compromise ashil lokanka pneumonia jaw chances urta. आणि ओरल हेल्थ निग्लेक्ट केले रे. फॉर एक्झाम्पल, इफ यू नेग्लेक्ट and eat a lot of chew lot of tobacco, chew lot of areca nut, and you neglect your burning sensation in the tongue, or if you neglect that you have difficulty in swallowing, then you might end up with the oral cancer also. So that is how kashi amgele periodontitis is, or oral health is related to general health, and it is mostly related to periodontitis, not the dental caries. But then again, dental caries can also एक पण bone anto spread जायना पुढे, then it can also lead to कसा म्हणतात का Ludwig's angina म्हणून असा, cavernous sinus thrombosis म्हणून असा. These are also life threatening diseases. Then how to prevent the gum diseases? As I told you, the funda is very, very same for both the diseases. That is, you have to have a very good oral hygiene practice. And otherwise, and also, periodontitis and ek extra asmalare. As I told you, caries prevention, oral prophylaxis or professional cleaning of the tooth is important. But gum disease, it is not important, it is mandatory. But the intervals of professional cleaning of your teeth varies from person to person. Again, I told you, there are a lot of risk factors, and the speed with which the disease progresses is different for different people. And so, professional cleaning of the teeth, manshaka, कितले intervals संजावका पड़ता is also different. So तुमगे dentist तुमका advice करता once examination करना पड़ता. So but professional cleaning at least once in a year, as a rule of thumb सांगेता, that once in a year पुणे पूरा लोक एक पण professional cleaning of tooth करोका पड़ता. However, how good is your oral hygiene maintenance or brushing method? And the last stage, एक पण significant bone loss जाए ना पण and but not tooth is अनिक हालता ना, tooth अनिक mobile जलना मळरे at least periodontal surgery करो protect prevent, I mean tooth loss पुणी prevent करे, but that is not reversible. So tooth loss is not healthy. Tooth loss you have to prevent, because एक पण tooth loss जाए ना पण कसा जाता म्हणून we'll discuss later. So professional cleaning करू का पड़ता. So what they do is just तुमगेले oral cavity clean करताच तितलेच. तेंगेले ultrasonic एक instrument असता, ते घेऊन होतानी तुमगेले पूरा दांताच surface वैर ते move करताचे. And this is a very easy procedure. कसा नाही pain जायना, and only thing is in some places तुमगेले तोंडाच एक दांता लेगी तुमका थोडे sensitivity जाऊचे chances असता. But at that time तुमका जाता असले रे, त्या टाइम तुम हायजिनिस्टला सांगेत अंग सेन्सिटिव्हिटी असं त्यांनी थोडे केअरफुल जाऊन करताच. So this is the example. So these are the पढ़ायले म्हणके this is nothing but deposits, mostly calculus. The काळ calculus is more dangerous than the yellow one always. So oral hygiene habits कशास का? You have to have the good brush, definitely, no doubt in that. You have to maintain brush for a maximum of 3 months, or the brush is till the brush is worn out. whichever is earlier, not whichever is late. So minimum every 3 months का brush change करका, even though तुमका brush normal दिसल्यार बी microscopically तांतू भितरी changes जाल्ले असता. So the efficiency brushaचे उण जाता. आणि correct brushing method is inevitable without lot of pressure. So invariably आमगेले लोक कितले केल्यार बी, even including me, we don't know how much pressure आमी दांता वयर घालता सच म्हणून न्हू. So it is better you use a soft brush than the hard brush, because we don't know, we don't have a sense, आमगेले tactile sensitivity आताचे is not so great to identify आमी चड pressure घालता सच म्हणून. This is where आमगेले electric toothbrushes are getting a upper hand. So what is this electric toothbrush? Electric toothbrush, I hope tum kottu loka ko gota sa. It is a new thing in the market. They are very, very efficient in the oral hygiene maintenance. I am not saying just because it is a new. I studies ani म्हणल्यार scientific studies achana results पळोवन तदनंतर तुमका सांगता सा. कसं लायक म्हळ्यार electric toothbrushes सांगतो compared to manual toothbrushes, they will have a timer. Then you have to brush at least 30 seconds per quadrant. आमगेले तोंडान 4 quadrant आसाची. So 30 seconds per quadrant you have to brush. Because आमगेले brush is so big that it covers 2 to 3 tooth per stroke. So if they have counted how much time is required. So minimum 30 seconds are required. So minimum 2 minutes pune brush karka padta. So these will have 2-minute timers, and the latest one even have AI which tells you that whether you have brushed all the parts of your oral cavity also. Of course, the expensive ones. And the आणि आता newer advances म्हळ्यार pressure sensors asache. The pressure sensors will tell whenever you apply too much pressure on your tooth, it will vibrate. So it will tell you that okay, you are applying too much pressure, back off. So that is another added advantage. And because of oscillating movement and rotatory movement, the plaque removal is very, very efficient compared to the manual toothbrushes. Manual toothbrushes antu okay, तुम्ही perfect toothbrushing method use केला रे, definitely it will have a very good plaque removal capability. But how many of us know, or including me, how many of us actually use the accurate method of toothbrushing? No, we might miss out somewhere. And think about old people or children or people with handicap, or orthodontic, for example, they will have difficulties in properly brushing. So that is where I feel that electric toothbrushes more efficient this maka. So this is the actually correct brushing method. You have to brush a 45-degree angulation to the tooth dharka of the outer surface, and then move it vertically downwards, or you have to use a vibratory motion there. But at no point you should use a horizontal rubbing method. It should either be vertical or vibratory method. And after brushing the outer surface of the tooth, you have to also brush the inner surfaces. And after that, तुम्ही खाऊचे surfaces, occlusal surfaces म्हणताना chewing surfaces they clean karka. So that is the once you do all these surfaces, then your brushing is over. As I told you, every 3 months you have to change your brush, and not only brushing, you have to use the dental floss. I think I put this in the poll also. Must only lokana answer kela that they use the dental floss. Please at least use the dental floss, because dental floss is only correct method or very efficient method for majority of the population to clean the surface between the teeth. Of course, it is old age antu where gums recede jali lokantu floss is not so efficient. then तुम्ही इंटरडेंटल ब्रशेस आणि यूज करका पडता. दॅट इज एडिशन. that is तुम्ही डेंटिस्ट यू विल डेफिनेटली प्रिस्क्राइब यू इफ तुमका इंटरडेंटल ब्रशेस जावका पडता म्हणजे जाल्यार. बट अदरवाइज इफ इट इज नॉट प्रिस्क्राइब्ड देन फ्लॉसिंग तो तुम्ही पुरा लोकांना प्रॅक्टिस करू का. इट इज नॉट डिफिकल्ट. You have to take 18-inch dental floss, wrap it around the fingers of your both the hands, and then use the thumb to direct the thread between the tooth. Not just moving it out and in. You have to toothचे convexity जाका तुम्ही ते rub करका पडता, so that it will remove the plaque properly, म्हणजे efficiently from the surfaces. So gently follow the curves of the tooth. मस्त चढ फोर्स यूज करचा ना, दादर ना जाल्यार तुम्ही जिंजायवा म्हणजे गम्स इंजोर करताचे. So you have to be very gentle when you are applying pressure, when you are going towards the gums, but don't do vigorously, just go smoothly and then follow the curves. Dantach curves use करून with practice definitely तुमका कळता. If you are not sure how to use it, please तुम्ही YouTube or videos वर के पळो येता. But this is, I recommend that at least I chen तुम्ही फ्लॉस करचा स्टार्ट करायचं. बिकॉज मेजॉरिटी म्हळ्यार ओल्ड मिडल एज अंतू केरीस जाऊचे चढावत दांता मद्दी दांताचे आउट खाऊचे सर्फेस अरे नाही. आणि दिस इज द मेजर रिझन फॉर मोस्ट ऑफ द रूट कॅनल्स लेटर ऑन. बिकॉज ते दोन दांतामध्ये आशिल्ले आजन आमकां दीस वर केना कॅविटी जाला म्हणून. So other कोणकी विचारलाय what are the other methods which can use other than brushing म्हणून. So one of them is of course floss. Other than that you can use mouthwashes. Mouthwashes are very good for one thing I forgot. Flossing तुम्ही brushing आचे पुढे करका before you brush, and mouthwashes you should use after brushing, at least 1 hour after the brushing. खंयचे माउथवॉश यूज करका म्हणून तुम्ही डेंटिस्टाला विचारता. अदरवाइज कसरे ना जाल्यार लिस्ट्रीन ना जाल्यार कोलगेट टू माउथ रिन्सेस तुमको पुरा जनक ಗೊತ್ತು शकरो ते तुम्ही रेग्युलरली यूज करता. बट तुम्ही माउथवॉश बाय करताना प्लीज तांतू भितर पळयाचे that there is no ethyl alcohol as one of the component, because ethyl alcohol considered as the carcinogen, म्हणजे cancer causing. So please mouthwash with alcohol buy कर नकाचे. आणि also don't if your dentist sometimes had prescribed you chlorhexidine mouthwashes, don't use it for eternity. It is only supposed to be used for maximum 6 to 8 weeks. त्याचकिंत चढ यूज केल्यार दुसरे साइड इफेक्ट्स जातात. But other tooth mouth rinses like fluoride containing mouth rinses like Colgate, Listerine, which is cetylpyridinium chloride, हे पूरा तुम्ही lifelong work use करेत. They are only supplements. Remember, they are not replacement for brushing. They are only supplements. Oral hygiene habits other than these can be, you can use chewing gums. Chewing gums are very good because chewing gums कसं करता म्हळ्यार तुमगेले उष्ट प्रोडक्शन चढ करता. त्या उष्ट चढ करचे प्रोडक्शन चढ करचे निमित्ती प्लाक अक्युमुलेशन, बॅक्टेरिया अक्युमुलेशन उण जाता. आणि इट ऑल्सो माउथाचे पीएच हाई करता. आमगेले माउथांतू पीएच 5.5 असल्यार केरीस जावचे चान्सेस चढ. म्हळ्यार ते बॅक्टेरिया जो आसा स्ट्रेप्टोकोकस म्युटन्स म्हणून ताका 5.5 pH जाल तशी ते ऍक्टिवेट जाता आणि केरीस प्रोडक्शन करता, सॉरी ऍसिड प्रोडक्शन करता, विच कॉजेस बट दिस वन चुईंग गम्स नाजाल्यार चाप जन नाजाल्यार बडे सोप आमी चू करतात जना कसं जात म्हळ्यार तोंडांतू सलाइवा प्रोडक्शन चढ जावन प्लाक pH लेवल 5.5 किंता चढ जाता, and that prevents the dental caries. But of course you should use sugar free chewing gums. Don't use chewing gums containing sugar. Of course at the market to Germany, of course they are all xylitol chewing gums most probably, but in India you still get chewing gum with sugars. And then toothbrushing among children, is there any consideration for children कसं different असवा? Yes, चेडवां थोडे different असा. कसं जालें म्हणल्यार चेडवां दांत also different. चेडवां दांत are smaller in nature, they have softer enamels, आणि तांगेले enamel composition also different, आणि तांकां caries जाव chances adults गिंता चड, because the tooth is structure is different. So that is why you have to be very careful. Oral chadwal oral hygiene maintain karche, the adults al oral hygiene maintain karche important, because chadwan jalli caries it will propagate into adulthood also. For example, chadwa astana amka chad caries ashil asleri, there are higher odds of you having caries in the adulthood also, because the bacteria are same, only tooth surfaces change jata. आणि सಣ್ಣ असताना अशी హ్యాబిట్స్ ఓడ్ असताना कंटिन्यू जातात. सो चरडू म्हाका सान दवरनुची लायक हॅबिट्स ऑफ ओरल हायजीन शिकोवच्या जेन्ना, और ते एक अभ्यास केल्ल्या जेन्ना, तेन्ना लेटर दे विल हॅव अ व्हेरी गुड ओरल हायजीन. कशें करता म्हळ्यार सान आसतना लायक बिफोर द टूथ फर्स्ट टूथ एरप जावचे तोंडांत 6 months आसता चेडू. सो ताजे किंत फुडें दवरून तुमी क्लिनिंग करता, बट यू डीड नॉट यूज द पेस्ट. You just use the finger brush and gauze wet pads, such and you can clean your clean the mouth. And then once the tooth erupts, तुम्ही फ्लोराइड कंटेनिंग टूथपेस्ट यूज करचे जाता. पहिले ओल्ड गायडलायन्स प्रकार अप टू 3 years फ्लोराइड कंटेनिंग टूथपेस्ट दिवचे ना म्हणून आशिल्ले, बट अकॉर्डिंग टू न्यू गायडलायन्स यू कॅन स्टील यूज द फ्लोराइड आशिल्ले टूथपेस्ट, बिकॉज द रिस्क्स ओवरवे द benefits if you don't use. So you can use, but definitely the quantity of the paste matters. 1 to 3 years aka parents and brush karka, and after 3 to 6, after 3 children can start, and start brush karse start kare independently. Why? Because up to 3 years swallowing reflex anika completely develop jalla sana, and they tend to swallow the toothpaste. Slide move jata na, 1 second. Okay, so under 3 years you have to use only a smear of the toothpaste, not much. Or after 3 years you can use the pea-sized amount. But if you are tumgel chardu, if there is a medically compromised condition jo asa, najalere swallowing affected asa, in such cases it is better to consult the dentist and individually with the dentist plan करचे like. So तुमकां आतां कळचें करो that that it is mostly the diet that is the villain here. Dental caries cause करचे का, and also to some extent periodontal disease or food affect जाता, but not direct way. Diet and nutrition are different. पूरा जना को गोतर्शकरो ना, diet is तुमगेले directly तोंडांतो affect करता, nutrition तुमगेले body effect जाऊन तदनंतर indirectly mouth affect करता. So nutrition like असलेरे periodontal disease जायना, आणि diet like असलेरे dental caries जायना. So avoid eating sweets, sticky foods, aerated drinks, and of course ratri sweets खाऊचे stop करका. Water also helps, and eat lot foods with lot of fibers. Hanga fruits and vegetables barela way, but I would not encourage eating apples and banana, especially at night after brushing, because banana antu carbohydrate asta, sugar, and it can streptococcus mutans can metabolize this sugar, and also apple antu malic acid asta, which is also carries risk factor. So they don't fruit avoid karache ratri, otherwise at daytime it's okay. And it is also always better to fooda santik couch better whenever a person eats sweets now. It's always better to eat with the food rather than in between meal snacks. So that ends dental caries and periodontal. Third important or most common disease is malocclusion. Malare amgele mal alignment urcha bro. Malare amgele arches, jaws arches are U-shaped. So हे यू शेप सोन दांत मागशी और मुखार उरता ताची आला आर्चाच मुखारी नाजाल्यार आर्चाच मागशी गेल्यार ताका माल अलाइनमेंट म्हणटाची नाजाल्यार रोटेटेड असल्यार क्रुकेड टूथ म्हणटाची समटायम्स there is a gap between the teeth, there is a spacing, sometimes the space is very low to adapt accommodate all the teeth, so they add ud jatachi, so the crowded म्हणटाची. So these are all the different types of malocclusion. Other than that, there is one more severe kind of malocclusion, that is amgel upper and lower jaw is not in balance. Ek mukare than the other. How to treat the malocclusion? Of course, Kiefer orthopeda, najalar orthodontics mantachang English antu. So in Germany, you have all the options orthodontics aka. There are very good orthodontists there. And treatment haka most probably fixed braces astat. Most of the malocclusions haka fixed braces galka padta, removable very minor cases matra use kareta. And latest one antu bitare is Invisalign. Invisalign is removable, but must costly jata. Malari based on individual condition, computerized computer use korno, AI use korno, they design many multiple trays which has to be worn one after the other in planned manner, and that helps in the rearrangement of the teeth. But they cannot be used for all the types of malocclusions. Only few types of malocclusions anta use kareta, and it is much more expensive than the classical fixed braces. And always remember, it is earlier the better. Young astana kelle treatment for malocclusion is easier, faster, and long lasting compared to the one done at the later age of the life. Then there are other problems. Discolored teeth. Discolored teeth का दुसरं कारण असाची आमगेले दांत फॉर्म जावची इयर्स आन उदका भितर चड फ्लोराइड आशिल्ले असल्यार नाजाल्यार मदर आन प्रेग्नंट असताना टेट्रासायक्लिन्स तसले अँटीबायोटिक्स आनी कंज्यूम केल्ले आशिल्ले असल्यार दांताचो कलर डिस्कलरेशन जावचे चान्सेस उरता, ताका फ्लोरोसिस म्हणटाची. आनी देन देर आर एक्सट्रेन्सिक स्टेन्स लायक टोबॅको यूज केल्ल्या जेन्ना उरचे पुरो, that is very easy to handle because ते भायर असतं स्टेनिंग आणि फ्लोरोसिस आणि भितर पुरा स्टेनिंग भितर असतं, so it is difficult to manage. टेट्रासायक्लिन संजल्ले डिस्कलरेशन आणि टूथ ट्रॉमा अंतू समटायम्स दांताक ट्रॉमा जाल्ले असल्यार म्हळ्यार सायकलाच्यान पळोवन नाजाल्यार काही एद्रा मार पडिल्लो असल्यार ओवर द कोर्स ऑफ टाइम ते दांत भितर डेड जावन कलर चेंज जाता. So कसं करायचं असं असताना प्रॉब्लेम्स म्हळ्यार there are smile designing, but this is also again very expensive and differs from case to case. Worst cases अंतू you'll have to probably दांत काढ replace करका पडता. In easier cases अंतू probably bleaching तसले small treatment is might also help. And then there are other minor diseases like एफ्थस ulcers. हाजे cause कोणाको गोतना बरो लोकांक जावचे पडना ना तुम्हाला. So ताका मोस्टली ट्रीटमेंट कसं आहे ना, ओनली म्हळ्यार सिम्पटम्स उण जावप तशी पॅलिएशन करता, लायक व्हायटामिन सप्लिमेंट्स दिवचे, माउथ वॉशेस दिवचे तसं. And the most dangerous of all, oral cancer. Yeah, this is like most commonest cancer among men Indian, because Indian to churd chewing form of tobacco use karta che compared to Western countries. So the anga Indian to churd. So this is easy to prevent because majority of the cases anto tobacco nimit jalla jana, you just don't use tobacco, and probably definitely in 90% of the times you will not get cancer. But if it happens to you, doesn't mean to tobacco use kelna shil 10% of cases there was no use of tobacco. There were other causative factors like loose ill-fitting dentures, najalari sharp tooth, najalari syphilis, तसं डिफरंट डिफरंट रिस्क फॅक्टर्स ಅಂತ बी ओरल कॅन्सर जाल्ले आसा HPV व्हायरस इन्फेक्शन ಅಂತ बी आता मस्त ओरल कॅन्सर जावचे स्टार्ट जाला. So it's not impossible to get oral cancer if you don't have tobacco habit. So that is why I put this slide. So at least if you have something like this and it doesn't resolve 2 week anto, please go and see the doctor. White or red patch of the skin असले रे ना जाल्यार अल्सर आसा ते हील जाताना खंय उरते पुरते अल्सर तोंडांतू बट 2 week चड हील जालना म्हळ्यार प्लीज निग्लेक्ट करनाकाचे आनी खंय तरी स्वेलिंग जावं लंप आसतना प्लीज डोंट निग्लेक्ट. आनी पॅलेटांतू जाल्यार ऑफकोर्स तुमकां गिल्ट चेक आनी कश्ट जाता. सो दॅट कड बी ऑल्सो अनदर सिग्नल. सो प्लीज असले असताना गो अँड सी अ डेंटिस्ट ऑर अ डॉक्टर and evaluation करायचे. So coming to missing teeth. Missing teeth is not 100% preventable now. Most of the sometimes you might be having very good oral care घेवचे पुरो रूट कॅनल करोचे पुरो बट रूट कॅनल probably complicated आशिल्ले ना जाल्यार डेंटिस्टान सम करनी सो probably ते फेल जाले. So 10% to 20% cases of the root canal fail जाताची आणि repeat root canals are either very expensive because not paid by the health insurance or the chances are of success are again very 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 low. So they don't recommend at all. Or कसं म्हळ्यार एक पण टूथ रूट कॅनल केले टूथ फ्रॅक्चर जावचे चान्सेस असता. सो ते रूट कॅनल केले टूथ फ्रॅक्चर जाले त्यानंतर ते रूट कॅनल रिपीट करू जायना. सो इन दॅट केस ओनली ऑप्शन इज टू रिमूव द टूथ. बट रिमूव टूथ केले ना पण ते रिप्लेस केले ना जाल्यार कसं जाता म्हळ्यार ते दांत एक दांत गेल्ले असल्यार नाल्यार 2 दांत गेल्ले असल्यार ते दांताचे नेबरिंग टूथ माइट स्टार्ट मायग्रेटिंग इन टू दॅट प्लेस. सो मायग्रेट करताना ते दांताचे ॲक्सिस चेंज जाता. दे विल नॉट बी स्ट्रेट, दे विल बी हॉरिझॉन्टल ऑर ओब्लिक इन कंपेर्ड टू अदर टीथ. ते कसं जाता ताजेर पडचे फोर्सेस अबनॉर्मल जाता. सो फोर्सेस स्ट्रेट पडल्यार मात्र आमगे दांत ते फोर्सेस घेता. बट when the forces are abnormal, दांताची लाईफ उणी जाता होता. सो वन टूथ लॉस कॅन लीड टू लॉस ऑफ द नेबरिंग टीथ ऑल्सो इन ड्यू कोर्स ऑफ टाइम. आज ना फाल्याक ते दोन दांत वेरकी कमी जाता. अँड ऑफकोर्स लॉंग टर्म इम्पॅक्ट आसाची दॅट इज once you to lose the teeth, तुमगेले nutritional capacity is less. You will have a nutritional deficiencies. Nutritional deficiency leads to immunological disorders. म्हळ्यार immunity of the resistance of the body कमी जाता वता. तुमगेले ऑफकोर्स द लाईफ उणी जाता वता which is actually मस्तीतले लोक निग्लेक्ट करता वताचे. So you have to replace your tooth whatever it is. So the missing tooth आम्ही कशी रिप्लेस करका म्हणच्याका डिपेंड्स ऑन खंयची टायप ऑफ मिसिंग टूथ आसा तुमकां. फॉर एक्झाम्पल हे फर्स्ट पिक्चरान पळोवचे पुरो ओन्ली येद्रा दांत आसा मागशी दांत ना. मागशी दांत ना हांगा. सो मागशी कसने सपोर्ट ना आशिल्ली न्ही ती ओन्ली ऑप्शन इज डेंचर. बट हांगा येद्रा एक दांत आसा मागशी एक दांत आसा आनी मध्य मात्र दांत नाची. सो हांगा येद्रा दांताच्यान आनी मागशी दांताच्यान सपोर्ट घेवन मदी एक ब्रिज बांदयता. सो दॅट इज easy to replace. So always as soon as possible try to replace. So dentures and different options asache. This one, the first one is a very cheaper one. Ubergangs prothese म्हणताचे जर्मनीत. This is nothing but immediate denture or interim prosthetic. म्हळ्यार it is not permanent. हे denture हे final denture right side आदिशी तुमका. हे interim. So हे घालचे ते हे आक्का वरके German health insurance guidelines प्रकार you can go for this one and then after some time you can go for this one. Then there are bridges as I told. मुखार दांत मागशी दांतात सपोर्ट घेवन मध्य एक दांत मध्य एक ना 2 दांत घालचे. कितले दांतात सपोर्ट घेवका पडता म्हणून डिपेंड्स ऑन द नंबर ऑफ टीथ दॅट आर मिसिंग. ओके. सो एक दांत मिसिंग असले 2 दांतात सपोर्ट पुरो. 3 दांत मिसिंग असल्यार प्रॉब्ली 4 दांताचे सपोर्ट घेवचे आवश्यकता असता. थर्ड ऑप्शन इज इम्प्लांट्स. आता तुमका एक फर्स्ट पिक्चरान दाखयला लास्ट खंयचे दांत नाशिल्ले सपोर्टाक. सो इन दॅट केस कसा करचे येता डेंचर घालका वाय ना यू कॅन गो फॉर इम्प्लांट्स. इम्प्लांट्स कसं करतात म्हळ्यार टायटानियमाचे एक मटेरियलाच्यान एक स्क्रू तुमगेले दांतात बोन्सांत भितर घालताची आणि ते हील जायना पण ताजे वयरच पोर्शन आका दांत फिक्स करताचे आका इम्प्लांट म्हणचे and this is the most expensive form of tooth replacement म्हणत. So you can go for one implant, एक दांत गेल्यार एक इम्प्लांट करता ना जाल्यार दोन तीन दांत गेलेच म्हळ्यार probably natural tooth आणि इम्प्लांट घालून ताजे सपोर्टाचे ब्रिज वर्क करता और completely पुरा दांत गेलेची तेन्ना एक 4 ना 6 इम्प्लांट घालून ताजे वयरी डेंचर वर्क फिक्स करता. This is the very efficient way of replacing the teeth if you have no teeth. म्हळ्यार डेंचर्स एज यू नो तुमकां गोतुरच्या पुरो घरांत कोणी असल्यार डेंचर घाल्लेले that it is uncomfortable. दांत खावचेक it is not very comfortable. उलोवचेक it is not very comfortable. So in that case, implant support denture are very, very efficient compare केल्यार. So coming to the last topic, म्हगेले आयज प्रेजेंटेशनाचे हे जर्मनीन कशी आसा डेंटिस्ट्री. मोस्ट ऑफ द तुमगेल्यान कोणी डेंटल ट्रिटमेंटाक गेल्लो आशिल्लो आसल्यार तांकां ऑलरेडी गोत आसता that it is very, very expensive म्हणून. So Germany healthcare is slightly different than India. आमगेले इंडियान we have आमगेले private health insurance and private health insurance पूरा का पे करता except for the dental treatment. But I think of course dental insurances be आयला the Indian and of course the premium for those is very, very high and the conditions are horrible. So compared to that, at least Germany there is health insurance which covers at least some part of dental monet. At least for that quality of treatment, you have to probably pay a little more to get a quality treatment. How to pay? Let us see that. One thing that is very good now Germany म्हाका भारी खुशी जाली म्हळ्यार dental विषय म्हळ्यार other than the quality of the treatment or quality of the doctors what I'm talking about is their health insurance system. The health insurance system, public health insurance system, most of you are publicly insured or so publicly insured on lakanka it covers 2 times in a year regular dental checkups, 2 times in a year, and once in 2 years complete mouthचे x-rays. So this is very, very nice feature म्हणून म्हाका दिसलें. कसं म्हळ्यार most of the dental caries तुमकां जावचे it happens in increments of say 18 months. So 2 years is good enough time to develop one new caries lesion. So that time तुम्ही एक 2 yearसाक एक बायटविंग रेडियोग्राफ केला 2 years तुम्ही अनेक रेडियोग्राफ करताची so you can see whether new caries lesion जाल्याच की ना. And this is nothing but prevention. No, why? Because if you go to regular dental checkups Germany and if you are publicly insured and you're supposed definitely should go 6 months एक month गेले रे तुम्ही 5 वर्ष गेले रे तुमगेले डेंटल रिप्लेसमेंट डेंचर्साक तांणी 60% जागेर 70% दिताची. And if you go 10 years, every year if you go for checkup for 10 years, last 10 years, then you will get 75% of your dentures cost covered. So that shows that they want you to go for preventive health checkups, not for on the other end. Last tooth lost wait corner, then don't go for denture mantanatani. They are saying go for dental checkups, and if you go for dental checkup and still don't lose your teeth, we will cover some of it. And in addition to that, yes, it covers only 60% of the cost of the treatment or standard treatment. 60% of not all the treatment it will be covered, mind you. When I say 60% of the denture is covered, or whatever bridge or implant is not covered, bridge or denture is covered, then he decide kela like condition aka itle खर्च दिताची म्हणून. So त्या खर्चाचे 60% दिवचे ताने. तुमगेले dentist who you are going to might charge much more than that, but तांनी दिवचे 60% of what they have decided. Okay, so at least ते दिताची. And but you should tell your dentist that म्हाका standard treatment जावका, म्हाका advanced treatment नाका, म्हाका standard treatment जावका. So म्हाका म्हगेले insurance 60% cover जाता and remaining I will pay from my pocket म्हणून. So that is about it. But that remaining 40% cover खर्च करके you have dental insurance options in Germany. Dental insurance options कश मिळणार तुम्ही every month premium pay करका, and the services offered will depend on the premium. If higher the premium, higher the services. And definitely तुम्ही like insurance घेतील असल्याने there will be no waiting period also, but of course there will be 2 years minimum contract time is required. Other than tooth replacements, this dental insurance will also cover your professional cleaning of the tooth every year, and also will cover for your fillings. Because the fillings, तुमगेल full public health insurance will not give you 100% of तुमगेल fillings urtale nale root canals urtale full dina. They'll give you some fixed amount, say 150 euros for the root canal. They'll pay some 40 or 60 euros for the filling. The remaining you have to pay from your pocket. So the remaining amount will be paid by the dental insurance. And how much they will pay, whether they will pay 100% of the remaining amount or 70%, 5% of the remaining amount, will depend on the tariff. So before you buy the insurance, please see what is the tariff contains, whether they cover 100%, whether there is a waiting period, whether there is what is the minimum contract period. So you have to follow, no? Then only you buy the health insurance. But definitely, it should be everybody's list of insurances onto dental insurance aska. So I found this website. Just a second, I will show you. So this is the website. Can you see my website screen? Yes. So this is the website for one of the websites to cover insurances in Germany. And in that you have the option of comparing dental insurance also. So it goes like this. You have to go to the website. And dantu bitari, you have to select your date of birth. So suppose this is your date of birth. Once you select your date of birth, it will ask you some questions. Whether you are covered by public health insurance, whether you have missing teeth, whether you have already crown and bridges in your teeth, in your mouth, whether you have periodontitis. Sorry, this is in German. Okay, so whether तुमका periodontitis असवा की तुमका already treatment start झाला आहे म्हणून. So if you answer these questions promptly, then it will show you the rates. So various, there's just like a policy bazaar in India where तुम्ही different policy offers daketa, then you can select on your own. So these are the different these things, and you can compare various health insurance companies. So anto bhitar तुम्ही services follow येतांगेला. So here you can see here crown and bridges 100% cover, implants 100% cover, inlays 100% cover. So you have to compare it like this before buying, and of course have a consultation with them, ask them in detail everything before buying. But this should be one of your insurances if you are going to live for longer period of time in Germany. So I'll stop now.